So what brings you to WHX Tech, and what are you hoping to highlight?
Yeah, I was honored to be asked to speak at WHX Tech, and so I was at the previous Arab Health, now WHX, and I was speaking on the side event related to women's empowerment. So I know the organizers wanted to bring in a lot more, of that into the conversation, and so honored that they asked me to be here. I actually brought several other speakers to join, and so I thought it was important because this is a region where there's so much happening and there's so much innovation and there's so much to learn as well. It's also a very different region as far as healthcare delivery. We don't have the legacy health systems like we do in the US and in Europe oftentimes. And so innovation oftentimes moves faster here. So for me, as the CEO of DeepLook Medical, it's really interesting to see how technology can get adopted much faster here sometimes in the region than it can somewhere else.
DeepLook Medical flagship product is basically DL Precise.
Yes,
I just looked that up. So and it uses AI to enhance imaging of dense breast
Yes.
Tissue. Now, how does this technology address historically challenging diagnosis area and improve clinical outcomes?
Yeah, so we actually kind of bridge the gap between AI and actually older technology, just software. So it's really interesting. But what we do is we layer on top of and inside the existing hardware and other software that's there. We're the only technology that can visualize at the lesion level masses, especially in dense tissue. And so that means dense breasts, disproportionately affecting Black women, Asian women, Hispanic women, and over 50% of the world and 50% of all women have dense breasts, which means mammograms are not as efficient for them, and oftentimes cancers get missed or get found at a later stage, or additional imaging, ultrasound, MRI, and biopsies have to happen in order to rule out. And so what if you can just find it on your first screen? Because mammograms are standard of care for sure in so many areas, and they're highly accessible. And so making sure there's technology for the other half of the world and half of the population to be able to be visualized. And so and we're FDA cleared in Canada as well, in the UK, and we're actually coming to the region as well. And so it's important to we layer inside the hardware, inside the other software, because we're not a standalone product. And this is where partnerships come in. And so, working with our partners to integrate into their technologies to better visualize, patients in general, and that's very much what I was speaking about today as well, patient-centered care. So working together to have better patient care. But yeah, DL Precise, we visualize all imaging modalities and all soft tumor lesions. So, we do a lot of work first and foremost in breast because it is the largest and only annualized screening test that's now readily accessible. But we do a lot of work, and we started to do a lot of work in breast ultrasound, in lung, CT, thyroid, ultrasound, so many, liver, which is a very dense tissue as well. It's hard to see lesions. And so that's what we do. We simply illuminate it, we show it, and we highlight it. We also do one-click measurements and segmentation, which is really important because what radiologists are doing, they're looking specifically to a previous exam to see if something has changed, something has grown, something has changed shape, if it's changed in dimension. That's really important. It's also taking the subjectivity away from the radiologist, because right now they're doing it by hand. And they don't want to. It's not that they're not good at it, they just don't want to anymore. So let's give them a tool that makes them a little bit more efficient, and they can make better decisions as a result, and especially in dense tissue, so they can see it. And when I talk about dense tissue, especially in a mammogram, cancer shows up white and dense tissue is white. So you're looking for the cotton ball in the cloud. You can't see it, so it's white on white. And there's nothing you can do to change your density. The only thing that you can do is age. Typically you just get older, and sometimes it doesn't change anyway. And so what we're doing is we're just helping them visualize, and hopefully women or all people don't have to come back for tests that they don't need.
Right. Okay, that's interesting. Uh, Now, your experience, it spans across engineering,
Yeah.
leadership in medtech and philanthropy to Her Health EQ,
Yes.
right? So how did your journey prepare you to lead a company focused on AI, AI-powered solutions for women's health?
Yeah, it didn't.
It just did. Yeah.
It didn't, and I learned as I went. I'm an engineer,
Okay.
so what we do is we solve problems.
Right.
And I mean, AI, I graduated 25 years ago from, engineering school. I've been in the field for 25 years. I've been studying for 29 years. I mean, AI wasn't even a concept in anybody's mind until several years ago. So nothing prepared me for it, with the exception of I just kept on taking more leadership positions. I worked in corporate for many, many years. I then became a serial entrepreneur, honestly. And so I went down that journey. And again, as an engineer, as a philanthropist, I started a global nonprofit, just solving problems. And oftentimes solving problems as I go. And so, AI came up. Let's learn about AI. And in reality, it's a technology. It is like a hardware technology. It's like other software technology. It is just another type of technology. So when you grow and scale technology, it's the same. There's typically a way to do it. You do the development, you do some pilots, you try it, you make a few iterations, you go to larger pilots and things like that. And so the process, no matter what the technology is and what's going to happen in the next, 10, 15, 20 years, it's the same process. Sometimes it's different. It's a different type of, delivery mechanism. But in reality, it's the same. It's just, I learned how to solve problems. I learned how to lead teams. I learned how to inspire and kind of put the vision out there. I sometimes often, as my team makes fun of me, I have a way bigger vision, than a team to support that. But I see our vision. I see where the technology is going. I see the future. I see where we should be going. Not sure how to get there, but that's why you surround yourself with great, smart people, and you build to get there. And that's what prepared me. But in general, nothing prepared me for AI.
A natural
Nothing.
progression. It just happened.
It just happened.
Right. Now partnerships appear to be critical for DeepLook's growth strategy.
Yes.
So working with established names like Tempus and Barco.
Yeah.
Right? So what have these collaborations unlocked for your team's access to clinical workflows and scale?
Yeah, so we integrate directly with those types of companies into their product. So we're another segment into their product. We're a feature within their product. So it's actually quite interesting, because then they become more attractive to the customer because they have a different feature. And so partnership is the way that we're growing. We're doing it with other names like Sectra, like GE, like Philips, like Siemens, all of these others. That's how we grow and scale, because I also personally and industry-wise don't believe in every individual company has to be their own thing. We all have to work together to get back to patient care and make it better for the patient. And we, as DeepLook, as a small company, we do not have the scale of a GE. We're never going to have the scale of a GE. And you know what? I would rather partner with somebody like GE to distribute the product, to work within their product, not changing the workflow, augmenting it, adding to it, and making another tool for radiologists, for the oncologists to have to just make better decisions, because that's where efficiency in healthcare starts to show up, where we all work together in partnership.
Right. Okay. Now, women's health has often been underserved in medical innovation.
Yes.
Now, as both as a CEO and a founder of Her Health EQ, what systemic change are you aiming to drive, not just through products, but through advocacy and representation?
First and foremost, we need to talk about it. Nobody spoke about it years ago. I honestly I was one of the first speakers that were speaking about women's health. I made sure we had it on the agenda at a conference, made sure I would not attend a conference specifically to speak unless it was on women's health, because that was the only time it was being spoken about. Now it's much more of a generalized conversation, and that's exciting. Also, the other point is we're 51% of the entire global population. We have never had innovation created specifically for us, by us. that's the other point. So things that might have been created for women, maybe, in a small capacity, they were made by men. That's not a helpful innovation because men's bodies are different. Also, how we react to drugs, how we materialize in health conditions. For example, heart attacks presented women and men much differently. And women get diagnosed, I think it's 41 minutes later with a heart attack than a man. That's not acceptable. That is not acceptable. So on the advocacy side, I talk about it. In the US, I do a lot of work in Congress to try to get laws passed and things changed, obviously around the world as well. On the nonprofit side is making sure that there's equity and access to quality healthcare. That's first and foremost, and that's on a philanthropic side. But once you do it on the philanthropic side, you show the governments and you show the local communities that this works. And then my hope is that I put myself out of business. I don't want to have Her Health EQ outlive me. That's not the intention. I hope we one day get to shut ourselves down because communities and governments realize that investment in women's health actually helps their economy. It helps propel families and communities out of poverty because they have better healthcare, because they can live longer and they have better health so that they can, work. There's more opportunities for girls to go to school. Very much on the advocacy and philanthropic side. But when we talk about innovation, there needs to be innovation for women. There needs to be technology, there needs to be software, there needs to be hardware, there needs to be new things that have not even ever been researched before. There's conditions that I can tell you most men don't even know about. And honestly, many women don't even know about. And they're affecting, it could be 1 in 5 women. 20% of all women oftentimes, could have PCOS or endometriosis. That is actually oftentimes a fertility issue, which is affecting men too. And so, 100% of all women go through menopause. You can't stop it. It just happens. And we go through 7 to 10 years of perimenopause. Before that, everything's changed. Every condition comes out, and it's not a one size fits all. There has not been enough research or barely any research for that. So that's why we need to talk about it. We also need to make sure that there's women in leadership at healthcare companies to be driving these changes, women in research, money supporting innovative technologies for women, by women. And so that's what I would love to never have to hear myself speak again, because we've solved the problems. And again, that's my hope, that I never have to talk about it again, because we're equal and equitable and accessible for all people. So that's nothing's prepared me for that either.
That's your hope. Your
but
work will be done then.
There's so much work to be done, and it's not just a women's issue. It is a massive business opportunity. When we think about business opportunities, what's the next, what's the big next field? It's women's health. It's here. It's not next. It is here. It's happening. And it is an investment area. It is a business opportunity. And that's how we need to start thinking about women's health, because so much change around the world needs to happen. Quite honestly, we all come out of women. It all comes from women. And so making sure that women are healthier, and also healthier in their lifespan, not just in childbearing years, specifically the entire lifespan. And that just empowers and lifts up communities. And I'll be on my soapbox forever. So
That's amazing, really. I learned a lot. Yeah, my last question.
Yeah.
So in your view, what is the biggest opportunity for digital health innovation in this region today, in Middle East?
Honestly, I'll always say it comes back to women. I think it's women's health. It's very much women's health.
Okay.
In this region, we need to make healthcare accessible to all women. We need to have the innovative technologies for women. And I think it's around the world. I think it's very especially in this region. I also think regionally, the opportunity to have new innovative technology, which includes women's health, but all people health, is accessible. And it's here. because you're not dealing with legacy systems. So all this new innovative technology, it can actually get to the patient faster than it can in some of these other regions. And I think that's the greatest opportunity, why everyone's here at the conference, why we all want to talk about it, because it's the area to be in. And it's not just because the money is here, it's because there's new hospitals continuously going up, there's new clinics, there's new healthcare systems, there's people moving into the region from all over the world, and there needs to be healthcare for all of those people. And so it's actually really exciting.